Cytoreductive surgery and HIPEC that is performed to treat peritoneal cancer is a complicated surgery, and any complicated surgery is prone to have some side effects. The good thing is that by taking some adequate measures, we can prevent or minimize most of these side effects. Nowadays, there is something called prehabilitation that is done. That is, the patient is optimized before undergoing surgery. Undergoing a complicated surgery, a long surgery, a major surgery causes major stress to the body, and the body must be prepared to undergo this stress. The first thing that we ask patients to do is to exercise regularly. From the day the surgery is planned, some kind of physical exercise is advised. Even if it is only for a week or two, it still makes a difference in the recovery of the patients. If you are used to performing some kind of exercise on a regular basis, then you are advised to continue the same. For patients who are not used to regular physical exercise, we advise them to take a brisk walk for 30 to 45 minutes. For patients who are used to performing some kind of physical exercise like cycling, swimming, or some kind of dance form, or even doing day-to-day activities, the recovery from this surgery is faster. The next important thing is to do breathing exercises. From the day the surgery is planned, we ask patients to do some simple breathing exercises 3 to 5 times a day. They go a long way in minimizing the respiratory complications. It is important that you follow this advice very diligently and do the breathing exercises as many times a day as possible. Another important thing is the nutrition. Patients who have peritoneal disease often have fluid collection in the abdominal cavity or ascites, or they may be undergoing chemotherapy which has its own side effect, and thus the appetite of the patient may be low. For patients who require nutritional supplements, they are prescribed. For others, it is important to have good healthy meals, preferably fresh home cooked food that is rich in calories and proteins. A good intake of fluids is also important. 1 to 2 liters of fluid intake per day in the days preceding the surgery is very useful in minimizing the complications resulting from the surgery. Another important thing is to quit smoking and alcohol consumption. From the day the surgery is planned, you must quit smoking and alcohol consumption. It has been shown that patients who continue to smoke in the period preceding the surgery are more prone to developing complications. Some of you may have other chronic illnesses like diabetes, hypertension, heart disease, or asthma. It is important that you communicate with your doctor about any of these illnesses that you have and all the medications that you are taking. The physician will examine the patient before the surgery. These conditions need to be optimized before surgery is performed. The medications need to be regulated so that your sugar and BP are optimally controlled. The presence of any of these illnesses itself is not a contraindication or a reason not to perform the surgery, but they should be properly controlled before undertaking the surgery. The last and the most important thing to do is to have a very positive attitude. It is a major surgery and at times it can be very scary, but talk to your doctor, get all the information, clear all your doubts, and go for the surgery with the full confidence that you will get through it and recover and come back to your normal life as soon as possible.